our Heroes at Home segment.
Heroes at Home. We're sharing stories of area residents who are doing great things, from firefighters to fundraisers, veterans to volunteers. Heroes at Home is brought to you by the comfort people at Terrell E. Mosley, specializing in heating, cooling, and maintaining the air quality of your home or business. Online at terrellemosley.com. Hear more from our Heroes at Home by visiting WLNI.com.
And we welcome to the program for Heroes at Home, Kimberly Johnson, proud Lynchburg native, EC Glass graduate, Liberty University alumna. Kimberly, welcome to the Morningline.
Thank you. Thank you so much. I'm excited to be here.
Well, my introduction for you has, you're the CEO of United Community Solutions, and you've been making a significant impact both locally and internationally. Tell us, Kimberly, first of all, a little bit about yourself and your life in Lynchburg before we get into what you've been doing since you graduated from college.
Absolutely. So, yes, I'm Kimberly Johnson. I was born and raised in Lynchburg, Virginia. I graduated from EC Glass High School. And from there, from high school, I went to Hampton University. And so I've remained here in the Tidewater region in Virginia. And I went to Liberty University for my master's degree.
How important do you think it was for you to have gone to EC Glass, the proper high school in Lynchburg, rather than that dump Heritage?
No, very important. EC Glass was amazing. Like from the staff, from students, that my peers. It was an amazing experience, and actually that's how I got here to Hampton University, because my principal at the time, Mrs. Morrison, she worked with my teacher, Miss Jennings, because I didn't have the resources to go to college, and I had applied, but I wasn't fully accepted, so I had to go to like a summer bridge program. So they got together, and Miss Morrison came up with the funding for me to get to Hampton University. So that's how I got here. So yes, EC Glass is top notch, better than any other high school, and it's been very rewarding for me. And this is why I'm here doing the things that I'm doing now, because of two people who believed in me. I was able to get here, get my education, and now pay it forward.
You're CEO of United Community Solutions, and some of your projects include the, am I pronouncing this correctly, Asuaba Water Project?
Yes, the Asuaba Water Project. So, yes, that is a village, a community in Ghana. So I went over, prior to going to Ghana, I had a friend for years, Dr. Aji. He's from there. And so I always wanted to visit Ghana. And I was like, before I go over there, I want to make sure that I do something impactful. So being that you were from there, like, what can I do that can be very impactful? And so he went to the middle school in Asuaba, and what happened is that village, that particular area there, they didn't have clean drinking water. So a lot of the students were getting sick going to that school. And so because of not having clean drinking water, so we got together, we put the project together. He arranged everything. And then on behalf of United Community Solutions, we were able to donate to make sure that the project was successful, and it was. So we provided clean drinking water, and not only just it's built on the school, but the whole community over there can come and use the water, and it never runs out. And it's open to everyone. So now that entire community has clean drinking water.
And then tell us about the Montero Medical Project.
So Montero Medical Missions is a nonprofit organization. United Community Solutions partnered with Montero Medical Missions to bridge the gap in healthcare. So they're between like the uninsured and insured. So no one is turned away. So what happens is when someone comes through the doors of United Community Solutions and maybe maybe certain services or programs that we offer is not, say like if it's not covered by Medicaid or it's not covered by commercial insurance or something like that, our partnership with Montero Medical Missions, we're able to still provide services and not turn anyone away, especially when it comes to crisis or just any type of behavioral health treatment. And on the Montero Medical Mission side, there's here locally in the Tidewater region, there's a Chesapeake Care Clinic. So we also can utilize the Chesapeake Care Clinic for like physical health needs when it comes to like dental or any other like physical health needs that they may have. It can be addressed through this partnership. So yes, at Montero Medical Missions, we go all over the world providing anything from dental procedures, prosthetics, all those type of things to make sure that we're impacting other countries as well. And the newest thing is offering behavioral health treatment globally as well. So yes, that's our partnership and relationship with Montero Medical Missions. That's what we do there. And I'm actually on the board as well. So we work very closely together to make sure that we provide adequate services for people that are in need.
It sounds like your organization that you're CEO of, United Community Solutions, somebody presents a problem and then your job is to find a solution. Is that right?
Absolutely. And that's why it's named that, because it's about unifying in a way to have a tailored model for the people that come through our doors or that call or may seek information. We're able to unite in such a way to provide care or to provide the right recommendations to help, whatever the need is. So so at United Community Solutions, we're trying to we're big on partnering with several organizations so that if it's something that we don't do, we can get you to where you need to go. And it's not limited to just like mental health. So we are making sure that we're connecting to like physical therapists or dentists and whatever special needs that people have, or you need a clothing closet, or you need access to food and anything like basic needs. We're making sure that we have those partnerships and relationships so that we can actually help someone that come through our pathway.
We're speaking with Kimberly Johnson. She's a graduate of EC Glass. She got her master's from Liberty University, CEO of United Community Solutions. I'm reading here that you also are a breast cancer survivor.
I am. Actually rang the bell in October. It was a huge shock because it was a rare condition. I was diagnosed with Paget disease, and at the time I was 38 years old, but I started having symptoms of something in my breast 2 years prior. And so I'm in my early 30s, and not knowing that breast cancer was even possible for someone at my age, especially not hearing about it as much in my family. So when I decided to go ahead and I was advocating for myself for treatment, it was overlooked as like maybe a dermatitis thing and things like that. So I had to advocate and ask for a biopsy, and it came back that it was like a rare disease. Less than 4% of all breast cancer cases end up with Paget disease. So it's a disease that affects the nipple. So it's easily misdiagnosed because of the rarity of it. So yes, like I rang the bell in October. I'm so glad it stayed at stage 0, although I didn't get treated for it until like 2.5 years later. It was like a miracle to me that it didn't spread. So yes, I'm thankful, and that's part of my mission now is to get the word out about it and let people know, especially women, that it doesn't matter what job you have, if you're a CEO, where you graduated from, like cancer, it doesn't have a name on it. It's cancer. So yes, I am a breast cancer survivor, and I'm advocating for everyone to get treated, tested, all those good things.
We are so grateful that you are we're able to ring the bell in October, and we hope that continues. Governor Youngkin appointed you to the Virginia Board of Social Work, so congratulations on that. What message do you have for the community, your hometown community, for folks to be able to help out, much like you have done with United Community Solutions and finding solutions to problems? What message do you have for folks?
I would say start where you are, and if you are the one that's in a position that have the problem, to seek out resources, because you never know who you will meet. Or if you are the person who wants to resolve problems, start where you are. Start volunteering different places, getting connected, like connecting with organizations like mine. There is so many organizations out here that are open arms to wanting more people on the ground to help. So I would say that, like, have that open mindset to help people where you are. It doesn't matter. It doesn't have to be a big organization, or it doesn't have to be a real small. It could be anything that you like have access to, or you could go and knock on a door and just introduce yourself and just express that you have a need that you want to help or that you need help. So I would say, like, overall, just don't be closed-minded to helping others or receiving help.
Kimberly Johnson, CEO of United Community Solutions. Keep up the great work. We appreciate you being with us today.
Absolutely. Thank you for having me.
And we want to thank the Comfort people at Terrell E. Mosley for sponsoring Heroes at Home. They're online at terrellemosley.com.